A key challenge under the current paradigm of tobacco control in Thailand may be the lack of knowledge in social mobilization and in engagement with public authorities at local level, as indicated by the urban-rural gap. Another challenge may be the lack of knowledge to deal with social determinants of health, depriving the underprivileged capacity to cope with daily life stress without tobacco use. These challenges call for innovative research for further move the society into a new frontier of political, economic, social development on equity ground. Next is the last story is to deal with the Health Commission. I have to make this statement prior to going into detail. I am acting as a historian, and the Health Commission, they might claim they are the history maker, so we might not have to share the same opinion, and that difference might be beneficial to the society. This story deals with recent initiative in social mobilization, and this slide summarizes findings from a participatory-based evaluation of a publicly financed program on promoting healthy public policy using National Health Assembly Mechanism, or NHA in short, and health statute approach after the first 4 years of implementation. The National Health Assembly was decided to be a multi-level policy platform organized through participatory approach from local to national level, covering issues classified as national relevant, agenda-specific, area-specific, and issues related to health and environmental impact assessment. The health statute could be considered a participatory process organized initially at national level, then expanded to cover local level, aiming at a framework to guide policy formulation and implementation of all sectors. The evaluation explored changes across major program areas, that is the health statute at national, organizational, and local level, and the NHA of all the categories mentioned. The findings were graded into spectrum of non-progress to clear progress using color codes of red to dark green, respectively, and gray for no evidence. Based on a set of indicators agreed among the evaluator team and the program implementer, it was found that clear progression was observed in policy content formulation at the most. The least progress was found in information sharing process and deliberation among equally well-informed participants. There was no evidence to assess policy impacts in most program areas except in health statute, which was found no progress in all dimensions. One would say NHA is a copycat of the World Health Assembly with highly systematized formal procedures of participation at all levels. This raises a concern for more customized processes of social mobilization, especially at local level, with relevant and sufficient understanding of local context. Although the participation includes voice, choices, and representation, more inclusive processes of engagement with politically influenced actors and stakeholders in broader scope are needed for better consensus building. Participants should be better informed to engage in voice and choice making using more evidence gained from participatory approach and strong scientific methods. Thank you.
Thank you very much. So, Dr. Professor Paiboon, is commenting a big authority who hosts this Thai event, the National Health Commission Office. And you know that when you use Thai word for the National Health Commission Office, it's exactly using the same word as the abbreviation of the National Health Keeping organization right now. The Authority of Health Keeping is the COSOCHO. So he is commenting the very big body in this country. And sitting here as a speaker and audience is Professor Ammar, who is the advisor to the Prime Minister, to the head of COSOCHO also. So we may have to do something for improving whatever his observation are or is. The floor is now open for these three speakers, plus probably we make it better by having all speakers here, on the panel, and then try to target initially for these last three speakers, plus subsequently for all 6 speakers. So the question, comment, please, and please all the speakers come to join in the panel.
Just a reminder, the earlier question on people's participation is still on the parking, and I hope the participants or these 3 panelists would, one of them, tackle on that issue as well.
Can we divide some อาจารย์สุริชัยเชิญข้างนี้ได้ไหมครับ So now the floor is the floor is open, please. And I mentioned earlier that our former Minister of Health also sitting here, Dr. Mongkon. He is also have some linkage with all the 3 agencies we are talking about this morning also. Any comment, please?
Thank you. Good morning, and thank you for a wonderful set of presentations. My name is Nima Askari. I'm from WHO Thailand. I have a bit of a tongue-in-cheek question, and it's going to the presenters who were talking about whole system governance or their lack of in Thailand. Can you share with us what is your vision of a whole system governance in a complex health system which exists in Thailand with multiple partners? And can you name any country that actually has been able to deliver a whole system governance structure to answer that question? Thank you.
Who should be the right person to answer your question?
I let them choose.
Maybe Professor Ammar first.
Thank you. Because you mentioned my current role, I have been asked to be chairing a committee to make the 3 health insurance systems work together in order to lessen the inequalities among them. And it's, if you read at the terms of reference of the committee, well, if I read it, and I was very shocked, because it's very unlike any government committee I've come across. First of all, I have the honor of being chairman in a committee with both ministers of public health on it. It just by accident. We proposed this to the head of the junta to set up this committee, and I was sitting with one of the 2 ministers. We put up a series of names, including the one of the ministers, as well as the other minister, as a representative of the teaching hospitals. And anyway, so, but the simplest, if you have no history, okay, if you are in history free, okay, the simplest way is to have one health insurance system, okay, but we have a history. People have rights to which they are used to, and some more than the others. You don't take away all of them out of the blue. So I said, why don't we do this? At the moment, all the three outfits work independently. So why don't we try and do such that they all have work to do together? The very first action we are doing is just to set up a clearinghouse so that all the data used in payments, in the payment system, come through the same clearinghouse, same organization. When you have three organizations in dispute with one another, you set up another organization. That's the first rule of bureaucracy. Okay, but so we have this, but we actually have this already. But all in the middle, somewhere the NHSO decide to do their own clearing, so we have to clear that up, and so that's one of the things. We are now looking at the government is trying to introduce an emergency service, the last government. And being a populist government, it like together. So we have to sit down and work it out. And in the case of emergency service, the bulk of the work has to be done by the Ministry of Public Health, because they are the main providers in the system. But they also have to look at how much the private sector has to be participating and so on. So they have to start working on all this. Luckily, on this issue, so we are trying to have this organization. But in the process of our meetings and so on, the NHSO came up with a very interesting system when they went on a study trip together with the other two insurance organizations to Belgium. I wouldn't think of Belgium as a functioning government, but the government functions, but the politicians don't function, which is a very good thing to happen. But
It's like Thailand.
well, we don't function at all levels. But the Belgians have a system where there is as it were, a forum on arena where every organization involved in health, including the unions of doctors, nurses, including all the various insurance organizations, the providers, and so on, all sitting around together and bargain with one another. The key word is bargain, okay? With one another to divvy up the pile of resources that are available. And of course, the government is there too as the provider of finance. So we are thinking along those lines that we set up this this outfit. We have, again, when a committee cannot decide, you set up another committee. Okay, that's the second rule of bureaucracy. So the bureaucracy at that committee is headed by a most distinguished civil servant of the Ministry of Public Health, Dr. Suwit. I have to keep holding him back from trying to run the whole place, because we are trying to set up a bargaining forum so that people agree, and it goes to a secretariat, and it goes to the minister to enforce it. But the key dynamo is the process of these groups of people bargaining on different issues. Of course, I mean, it's not everybody sitting down and bargaining with everybody. Presumably there are ways of subdividing the groups, and groups forming and reforming according to the issue at hand. But that's the way I see it. I'm hoping for Dr. Suwit to come up with some sort of a solution. Okay. The key point with interministerial or intergovernment within the government of any committees that cut across all this, the key thing is to don't have the secretariat runs the show. Okay, it has to be a secretariat, and the secretariat will provide, so that the agenda and so on will have to be provided by the groups of people bargaining, saying this is an issue. So let's hope that we will do something out of this. I'm very hopeful that Dr. Suwit will sort this issue out, because my committee will then be able to say goodbye and hand the baton on to this committee. I have no interest in being the coordinator of the three outfit, because I don't know how to. Okay, but it has to be done in a the word is participation, right? In a participatory way, participatory at least of the three outfits, because they have their own constituencies to take care of, and they have to look after those constituencies. I hope I have given the current state of play in the case of Thailand. I don't know. We only hear second-hand of the Belgian system. Okay, but you might want to follow that up. I don't know whether it works or not. But
Okay, so
does it work?
thank you very much. Nima, you don't get answer, but you get the way to the answer. And that's the way. And we will see whether this answer is correct or not. But probably, I don't know, in our lifetime. Yeah. Anyone want to add? Yeah, Prof.
I guess that I understand your questions correctly. What I'm trying to do is, I think good governance is not a thing of a perfection status. There's some article arguing that there is no such a thing of perfect good governance, but there is such a thing as good enough governance. That depends on historical context or historical momentum of particular country. Let me share with you some story from a book I read. It's entitled The Origins of the Political Orders by Francis Fukuyama. He raised the case of Denmark, which to this day has been considered a close to ideal society, a very equitable society. Back very long time in the history, it is a very peculiar story that the king act as an advocate for the people to squeeze the aristocrat. This is very rare occasion and I'm not quite sure how he arrived at this conclusion, but there's some other external factor influencing the decision of the king to take that kind of position. So that's my point of the historical momentum. The next point is the common framework. I think there is no such a thing as an absolute common framework. Yes, we need to have some agreement on certain elements of the common framework. And I think the common framework needs to at least address the balance of power issue. It needs to lay out mechanism and process to give people of vested interest group, different groups, to have equal balance of power. And that's to let me make my final point, the viral factors. Some of you might be familiar with bacteriophage in biology. It is a kind of virus. And this kind of virus carry DNA from one species cross to another species. For example, from bacteria living on the trees down to the ground and down to the water. And the virus carry DNA which leads to mutation. And mutation is a key process of adaptation. We need mutation. There's movies about mutants, X-Men, those kind of things. That is the role of the viral factors. Viral factor could also mean a cross-fertilization among different set of mindset. And this will lead us to repeated innovations. Otherwise, we will face the same history of repeated global financial crisis, which based on some influential agency in the West try to impose the common framework of good governance on other countries without looking back into themselves. Thank you.
Thank you. It seems that we already have X-Men in Thailand. Dr. Suwit is mentioned like X-Men, a mutant. But I saw him this morning, but he left already because he know that he will be mentioned. Okay, Professor Dr. Mongkon, please, our former Minister of Health.
Thank you, Mr. Chairman, and all of the speakers. I came to this room and I like to know about the good governance. It's my intention, but I have some activities this morning, so I came a little bit late. And I have no chance to listen to the speaking of Dr. Ammar, Siamwalla. But the three speakers, including our St. George, St. Michael and George, and I think that is a very good mention about so many things about Thailand. But for me, I try to understand the governance in so many aspects. But I think that the final aspect for me, the good governance, how to be fair for everyone. But if we talk about the globalized meaning and do not try to implement the in the local area, or if we not try to bring the globalized meaning to the localized doing, we cannot make benefit for anyone. So that right now in Thailand, you see that all of us know that health is the pivot, is the center of all movement or development. So that it's concerned with so many determinants. And if all determinants, if all who are concerned with each determinant, don't worry about the effect of that kind of determinants to the health of people, it may make is not fair, not good for everyone health. So that you see in Thailand, we have a very long story, the same with the other country, that everything changes all the time. But people actually, they don't like to change. This is the main problem. What I think, even though you try to apply the good governance into the system, but if people, they want to stay in their comfort zone, they don't want to change. But the environment and everything's always change. That is the problem. Right now, you can see in the big hospital in every region of Thailand, so many people going to the hospital and very crowded, and there is not enough bed. There are not enough beds for all patients. That is not fair for them. That is not the good governance. That what I mean. They have to pay, even though Ajahn Ammar may mention with his members that maybe in the future co-pay is the chance of doing things. But for me, even though we try to providing free of charge for everyone, but actually they have to pay a lot for traveling to the hospital, especially for the aging people, for the chronic disease, so that it makes so many troublesome for the people. The same with 13 years ago, before we have the health coverage in Thailand. So that how can we make people, how can we persuade all people from the governments, from the level of public health, to look into the people in the grassroots, in the low level, and how to modify everything, modify the system to suit for making people more happy or happier from now on. I think 14 years ago, people living in Thailand is more happy than in the present time. I just came from, I went to the rural areas every month, and studying or observing the people living in the countryside. Even though they have to go to flock into the big hospital, but when they go to the community hospital, they are happier, and they can make a living better than living in the big city. So that how can we mobilize everything to to suit the situation of each group of people? It means we have to providing the decision for them all. We not just only decentralize, but we have to make them a full decision for everything. And right now, the same with I think Dr. Phaiboon already mentioned that we try to develop our system in Thailand, but if all of development done by the group of people who are not the democratic mind, they cannot know. They do not know the real situation. They not know how to go to the good situation for the people. So that I'm so worried. So that all of aspect in this PMAX, it's concerned about the health of people. But if you look back to those days, in the day of Prince MAHIDOL, the life of the people, the way of living of the people in those days is better in the present time. Even though most of us try to inform that we did a lot of things to improve the situation, health situation in Thailand, but actually the happiness of people get worse and worse. So how can we change our topic from so many meaning, so many sophisticated thinking, and it's a globalized topic to the localized topic, how to see the grassroots in detail, and after that come up to try to set the system in the central or in the upper level. Thank you very much.